So very good afternoon, ladies and gentlemen, and a warm welcome to everyone. So it is my absolute privilege to be a moderator of this particular panel discussion, where this one of the most important, critical, underappreciated area, that is a healthcare supply chain, is being disturbed and it is being avoided. And if we talk about traditionally, the supply chains have been measured by the efficiency, the cost, and even for the service level. But in healthcare, the supply chain are completely different. It's entirely different in terms of the metrics, profoundly, which talks about it entirely different. When we see that every avoidable or non-availability of the drugs and the implants in the hospital, and even at the time of a point of a care, the drugs which is not available and the continuity of the care is being disturbed, which directly impacts the quality of a care and it leads to the patient life also. So I also firmly believe that healthcare supply chain is no longer merely this our logistic track. It is also, this is not a logistic networking, it is more focusing on the patient center, and which focusing on the speed, governance, and at the same time traceability, the visibility, where the patient outcomes go hand in hand. So with the eminent speakers and the panel, let's begin this session. Let's understand and explore how AI, the artificial intelligence, the predictive analysis, and at the same time, how we can transform this healthcare supply chain into the more agile, resilient, and the healthcare resilient system. So let's begin with one of the most common question. I'll start with the ice-breaking question with all of you. What does this transformation of a cold chain into a care chain means to your organization, and what is that one change needed to make this healthcare supply chain more agile, resilient, and the patient-centric? So let's start with the Vikas.
Yeah, good afternoon all. So myself Vikas from Fortis. So in my opinion, a cold chain products, whereas the care chain protects lives. So in a healthcare, we are not making a manufacturing units, making a car or the watches, etc. We are playing with the lives. So in a healthcare, it's a different slightly with the supply chain management with the other industries over there. So what the difference is, what the transformation we look forward for over here, whatever the decision we have to take in a supply chain, we have to keep the patient in center. Like purchases, quality check, insurance, and making the who is the manufacturers, from where is sourcing over there, checking the raw material sourcing for the manufacturers over there. These all has to be taken in the patient care, and quality is the one of the most important aspects over there. Second, in a healthcare supply chain, we have various verticals: doctors, nurses, paramedical staffs, OT, ICUs, etc. Everywhere we are keeping the different stocks, emergency stocks over there. So visibility is one of the important part in a healthcare. Everyone in the hospital, management, supply chain, finance will know where the stock is lying, what are the emergency drugs that are available, what are the stocks that are available in the hospital that has to be available. So this is one of the key parameters in the healthcare for the supply chain success, to ensure the availability and to know where the stocks is lying in the hospital. Third is, in a healthcare, it's not a customer driven demand, it's a physician who is deciding for the patient. So the decision maker are the physicians, the consultant, and the clinicians. So we have to always involve in them for the decision making over there. Next, we have to use the digital transformation. In a healthcare, if we see, we are handling around 4,000 to 5,000 different SKUs in a healthcare, having a different batch, expiries, sizes, SKUs, and units, etc. So we require the RFID systems, the monitoring over there, the barcoding systems over there to make our supply chain very efficient in the system. Next, we have to involve the clinicians in making the decision making, because they are the who are physically examining the patient, evaluating the patients on the clinical and diagnostic reports over there. So which is best for the patient, like the customized medications, what are the salts they required, what are the consumables they required, we have to involve for the decision making in the system. Next important in supply chain is the data driven. We have to use the data for the past consumptions, who are the vendors, who are the suppliers, what is my consumption rate, etc. That has to be available for making the decision making, and have to take a quality decision making for the hospitals in the hospital. Next, very important for the supply chain because they are the gatekeeper for the hospital, the sustainability factor. What the material we are buying in the hospital, that has to be less impact on the environment, or maybe the zero effect or zero defect on the environment over there. So we have to ensure they follow the green practices, the DPCO, then the pollution control board guidelines over there, and the other agencies who are making the rules, so that we can have the safe place for the patient and for the healthcare in terms of materials and supply chain management. So in a nutshell, if we say, so we have to move the supply chain from the transitional basis to the focus basis, to the outcome basis, and see the patient in the center. And for the supply chain, so the warehouse is not ever the main area. The patient outcome, the satisfactory patients, the result-oriented patients, the treatment and satisfaction they are getting, that has to be the benchmark we have to consider in our supply chain. Thanks.
Well said, Vikas. Moving to the Mohit.
Hello. Thanks, Vikas, for giving some insights and sharing very relevant points over here. I'll add the third dimension to it. Being from the diagnostic industry, a very well known in India, having 300 plus labs in India and more than almost 7,000 collection centers. Our supply chain, we don't touch the patients, we touch their samples.
Correct.
So the supply chain is not only about moving the raw materials or the chemicals or the reagents required for testing. It is also a movement of samples. And I can't go back to the customer that I have taken your sample, sorry, I can't perform the test, I don't have the raw material.
Correct.
I can't say this. And also I can't say, sorry, I have taken your sample, it got contaminated because it has to travel long distances. Because my diagnostic report will define the further course of action on that patient. And we take our customers as patients, not as the only customers. Now the demographics are changing, the journeys are changing, people are moving towards preventive healthcare, lifestyle disorders are coming. So the chain has to evolve to that. Traditionally, we see the supply chains across all the industries are measured on cost competitiveness, rightly said by Amit, on inventory optimizations, on various KPIs of the supply chain, we all know. But will it answer one question, that will the right product is available for the right patient at right time? That is very important. That's where the healthcare supply chain has to change the gears as compared to the supply chains across other industries. The major change that the healthcare supply chains have to bring in is the digitizing each and every touch point, whether it is material or whether it is sample collected for a patient, from the patient. By doing so, having the real-time visibility of each and every touch point of the supply chains, automatically our chains will become agile and resilient. Agile and resilient are the outcomes of what we do with our inputs in the supply chain. Decades back, when we say, is your supply chain resilient? The answer is yes, I have 6 months of stock, I am ready for any kind of disruption or shortages. But is your supply chain agile? The answer is no, because agile supply chain cannot be resilient and resilient supply chains cannot be agile. This is what was happening decades back. Now in this digital era, we are seeing that the digital data that we have will make your supply chains resilient. If I can predict from my data that what is going to happen and what is the simulation scenario, that if a particular vendor is going for a shortage, how my chain will react, if I am able to simulate it from reactive to proactive approach, if I am taking up, that means my supply chain is resilient. I don't need a pile of stocks at my warehouses or in my labs. Now the decision, if you are able to change your decision, quick up your decisions with the data-driven technologies, that means your supply chain is agile and resilient at the same time.
Correct, Mohit. So I like the concept what you have mentioned, that moving from minimal error to the zero error. Okay. So moving to the Anil, so we would like to understand your perspective and your organization perspective on that.
Thank you for the question, and it's really pleasure to have with the experienced panel over here. So as far as the supply chain to care chain is concerned, so there are 3 critical parts which I would like to mention over here. First of all, if you would like to strengthen the supply chain process, by determining three steps over here. Number one is in earlier traditional days. So earlier traditional days it was measured by the three things. Number one, so whether the product was delivered on time, whether temperature was maintained in the transit, or the documentation was complete. So now the era has been changed, and now we must ask the supply chain a bigger question now. So whether the patient got the right product with full of efficacy and potency. So that should be the main goal of the supply chain should be as of now. So it should be enabled by the technology nowadays. So like if any shipment moves from source to destination, we should understand that it is carrying a lot of ops from the patient perspective. Number one, if any patient waiting for the chemotherapy who is suffering from cancer, and second one, any child who is waiting for the vaccination. So number third is any patient who is waiting for the life-saving drug, biologics. So these are the three critical metrics we need to keep in mind while handling the supply chain process. And these things makes mind shift from supply chain to care chain. That's all.
Correct, Anil. So we can say that every delayed in the medicine or non-availability of the drugs definitely impact to the quality of the care, which leads to the patient safety and their life as well. Yeah. So moving to the Vijay, if you can also help us to understand the perspective.
Yeah, very good afternoon, everyone. So as per my perspective of looking at, because I am heading a supply chain for a group which is having 14 hospitals, and this is again a supply chain role in the healthcare particularly is a very critical role what we are playing, because every time you are on the toe of the department in the organizations. So supply chain transforming from cold chain to care chain is definitely yes. Now what we are talking is everywhere is about patient or customer satisfaction. So ultimately what is given, how much the patient is satisfied with the quality in terms of healthcare, what is the outcome, what is intent to come from that product. Now to get the outcome, what is intent to be, what factors are to be monitored on timely manners. The foremost as per me is the visibility. The product what we are buying, the product what we are using, how much information do we have about that product? From where it is manufactured, from where it is traveled, how is the distribution system for that particular product once it reaches to an end user, that is customer. Now we also know that products are not manufactured in your city, it is manufactured somewhere else, and then it reaches to end consumer by different chain. So how these chains, the product is traveling, is maintained, whether the quality what has there at the time of manufacturing at the origin land to the consumption land, whether the quality maintained, you are getting the right quality. Foremost of that is the product what you are getting is whether it's a genuine product. Now we know that the grey market is expanding like anything. Counterfeit drugs are available. How a customer or a patient will feel that what he is taking is a genuine medicine. So this is becoming a very difficult for everyone. If your supply chain distribution has no visibility, you have no traceability system, you will never know from where the product is reaching to your warehouse. So we have to ensure, that's why how you have a system in place, a blockchain kind of concept, or you have a very strong SOP which you are keeping and tracking from end to end, so that the product which reaches to end consumer, that is patient, are in a quality what it has to be. The second is the availability. We know that the stock outs are very common, and that is because of your poor inventory system. How much we focus on demand forecasting, how we are planning, where we are using the AI, how we are planning our reorder level, and all those season fluctuations, variations, which lead to ultimately your stock positioning, inventory. So to keep the correct inventory, that is again a very important task for any supply chain management. That is what their primary KPI, the main KPI for us. It's not of getting a product in a cheaper price, but the KPI is to keep available all the essential medicines 24 into 7 hours. If there are any pandemic, epidemic, how we are making sure that supply is not interrupted. So first thing is quality. In the quality, what is our visibility? In visibility, how traceability we are ensuring. Second is what kind of inventory management process we are keeping. What are the demand forecasting? We have a plan. It should be a robust plan. And the third one is deliverer. How we are delivering the things. So for everything, now we have to actually healthcare, we have to learn from the food industry, right? Everybody we are using Swiggy, Zomato. The moment product start from pickup point, you have a track. You are tracking if the delivery boy stops somewhere, your time also stops. So you know that somewhere he has stuck and what time he is going to reach. So that is very good example, the things what food industry doing. Similar way, we also want to have in the hospital supply system, the process from when the product is started, when it is reaching to my warehouse, you must have complete traceability of each location, each places, because there are many cold storage product, temperature sensitive products, whether it is delivered in a right vehicle, maintaining the quality, maintaining the temperature at the end when it is going to be consumed, given to the patient, whether the drugs are supplied in a right temperature, that is very, very important to maintain the quality. So from my perspective of the supply chain in the healthcare, yes, it is transforming from cold chain to care, because we are ultimately a team member inside the healthcare in the hospital. So we are playing a very crucial role in the team, and we have to ensure that our positions, our role, what is there in the hospital or as a supply chain head, has to be delivered as per the expectation of the.
Correctly mentioned. So yes, definitely the end-to-end visibility and the traceability is very important, and at the same time the quality. Now considering the quality part and the compliances, I think Deepak would be the best person who can answer for this thing. So please go ahead.
Yeah. So thank you, Amit. Actually, if we see from a healthcare perspective, the supply chain has gone for a complete transformation in last few years, right? And especially after COVID, the way the GDP is growing, the way the penetration of the insurance is increasing, and the way the customer expectations are changing. Now they are no longer satisfied with the moderate healthcare, right? They want quality service to be delivered at a very right time, right? So because of this, the supply chain has to change accordingly also, right? And we have to change from the traditional supply chain, cold chains, where the objective was to store the product and deliver to the customer. Now we have to change the supply chain in a manner that we are able to deliver the care supply chain, where we are delivering the main focus is on the patient outcome, right? Rather than on the delivering just the product to the consumer. And also the continuity of the therapy that the patient is undergoing. So for this, the biggest change I think is required in the mindset of the organizations, because traditionally the organization treats supply chain as a back-end function, right? And which is just delivering the products.
Correct.
Now they have to change to the care mindset, and it has to be strategic delivery of the patient care to the end consumer, right? And this can be done by adopting the three things. One is the change in the success metrics, right? So traditionally the service level, the inventory turns, and these kind of the cost efficiency are the main metrics for the success of any supply chain, right? So now going forward, if you want to move to the care supply chain, then we have to have the metrics, inclusion of the metrics, which is the patient care, and the continuity of the therapy also included in the overall metrics that the supply chain measure, right? And it can be in sync with the overall objective of the organizations as well, right? The second is which I think is the most important, is the digitization of the entire supply chain, right? So digitization of the entire supply chain can help in overall visibility of the product when it moves to the entire network also, right?
True.
And we can do what we can do, that when we have the data and the visibility, we can do the predictive analysis in terms of the forecasting, which can give us the leverage in terms of the overall prediction of the consumer demand if there is any change, and help organization to adapt to the changing demand of the consumers as well, right? And the second is the IoT based tracking of the entire shipments also in the chain. And the third one is the complete visibility of the inventory in the entire supply chain, right? So this can give us the leverage, because we can optimize the inventory across the supply chain, and also make the product available when and where it is most crucially required in the entire system, in the entire network also. And the third point, which is also very important, is the collaboration between the various stakeholders also, right? So when it is very important that today the scenario is very changing very fast, and we have to collect the information. So the flow of the information is very, very important in the entire supply chain as well, right? So it has to have the close collaboration between the manufacturer, the hospital, the service provider, as well as the healthcare professionals, along
Correct.
with the government bodies as well, right?
Sure.
So when we have this information coming in very fast, and when we have the seamless flow of the information, then we can adapt the supply chain accordingly also, and make sure that we are delivering the right product at the right time to the consumer, right? So these are the three major shifts that the organization has to do to convert this into a care chain rather than the cold chain, which is right now, which is we are delivering the product. Yeah.
Very well said. So yes, just to be stick on the same thing only, Deepak, I have one individual question with you. Considering that manufacturer supply chain have traditionally focused on the efficiency and service level, and as therapies become more specialized and the patient expectation continue to rise, so how can pharmaceutical manufacturer move beyond service level to ensure clinical reliability, and where treatment continuity and patient outcome become key measures for the success?
Yeah.
So what is your point of view on that?
So I've already mentioned 3 points. One is the KPI, second is the digitization, and the third one is the collaboration between the stakeholders. The fourth one I would like to add is resilience of the supply chain as well, right? And delivering the quality product. The quality is another important product, and the traceability of the product, right?
Correct.
So I can give you the example how we achieve this in Bausch & Lomb, right? So in Bausch & Lomb we have digitized, because we were seeing that there is a change in the consumer pattern also. Now the consumer want the quality product and at a very, very fast delivery. So we should have the traceability of the product as well in the entire supply chain. So what we did, that we did the digitization. We have spent a lot of time and effort in last few years in the digitization of the entire supply chain. So now in Bausch & Lomb, the entire leg of the supply chain, right from the manufacturer as a company to the distributor, to the retailers, to the healthcare professional, all are connected on a single digitized platform, right?
Okay.
So now healthcare professional can place their orders also, can give their feedback. Retailers can place their order directly on the retailer app, which can be received by the distributor, and so the orders can be placed. So now we have the clear visibility of the not only on the primary data, but now we have the clear visibility of the secondary data as well, right? So earlier we were focusing solely upon the forecasting done on the basis on the statistical forecast based upon the historical sales data, but now we are relying on the secondary sales data, right?
Great.
So
what I need to understand, like, how do you manage the manufacturers, distributors, or the dealers, whether they are the impaneled under the Bosch, or like how do you see
sorry.
Whether these peoples are impaneled under the, or how do you see the, like in terms of a quality, whether like some quality certifications are there? So how do you see, or how do you calibrate all those peoples? Like,
So our is a medical devices organization, right? So we
Correct.
have to be very sure about the quality aspect as well, right? So we have to do a lot of certification for the distributors before they can be on the panel itself. So there are certain checklists. We do the DDQ for all the distributors and ensure that they have the facility so that the proper and the quality storage of the product can be ensured. and it can be delivered to the consumer in a very safe and the healthy environment, right?
Great. Thank you, Deepak. So, my next question to Mr. Vijay. We do understand that the hospital are the final point where supply chain management impacts, and it directly impacts to the patient care. So, how important, as you have mentioned, that the visibility, traceability, and it is very important. What do you have to say about the regulatory compliance, which is important in ensuring the patient safety, and especially in the hospital sector? So, how do you see that?
As I said, as we are moving toward care from cold chain to care management, there are a couple of things. One is definitely everybody talked about the quality, then everybody talked about inventory, everybody talked about supply chain. The important in the governments is, yes, regulatory definitely required for any process, either it is at the manufacturing side, or it is in the distribution side, or it is in the delivery side. So there are regulations, every regulation has to be followed. As we know that now, when we are talking about sustainability, everybody knows there are ESG, environmentally how it is impacting, what are the regulations they are following, the manufacturers. We also obtain some kind of data from them, how safe is their manufacturing, how much emissions are coming from their manufacturing plant, how much they are contributing in that. So what regulations they are following. Second is social. Yes, we also look in their contract and we also discuss whether they are following these guidelines. Is there any child labor in their manufacturing? How they are governed this under the government rules and regulations. We ensure that. And the third one is governance. Under which governance, what are the certifications, what are the regulations follows, and whether they do have all these certifications with them or not. So all this becomes very important nowadays when we are talking sustainability. What is sustainability means? What we are living for tomorrow. We are today, but our next generation, what we are living for them. So when we say what we are living to them is a very big subject where we have to see that how friendly is the environment, how socially it is impacted, and how governance structures they have. We too know that many of the manufacturers, when you deal with them, they submit all these certifications, ESG, compliance and everything. But do we inspect that? Whether it's said correctly they are following all these rules? Whether we verify their certificates? Do we have some kind of inspections going or through third party to check whether whatever they are committing for the governance structures, are they maintaining? So these are all ensures that if it is everything is complying, then it ensures that yes, the product, what you are getting it, the product which is ultimately reaching to a patient is governed by all these and you are getting a right product to your patient. That all gives the credibility, visibility, traceability, all these factors play an important role in delivering the quality care.
Correct. So yes, definitely well said. It is very much important to prevent from the counterfeit of the products and the drugs also. So moving to Anil, what I need to understand from you, like considering your tremendous experience into the cold chain and logistics and the quality system, what are the key operational and technology intervention that needs to be strengthened, cold chain's integrity, prevent counterfeits, and ensure compliance across healthcare supply network?
So I would like to brief over here. There are 4 critical interventions which I would like to highlight over here in this context. Number one is end-to-end visibility. So when we talk about end-to-end visibility is the product should be monitored throughout the that moving process. So it should not be compromised any point of time from the quality perspective. In that case, we need to enable some AI tools which can help us in a greater way. Number one, that shipment should be that IoT enables. So another one is sensor, the location sensor that should be integrated with the shipment. In that way, that should be, ensure that whatever the product quality comes in that way, it is not even being compromised during the transit. So in that context, so not only it should be limited to the supply chain personnel, it should further that extend across the manufacturers and the logistic partners and the health care partners as well. And second one is that if you talk about the counterfeiting of the product, so in that case that product should be ensured throughout the supply chain process. It should be monitored through the again that AI tools, whereby that like some of the, if you talk about the technologies, like it should be configured with the blockchain assessment and the record, whereby we can ensure that whatever shipment is coming, it is not being counterfeited and it is not be compromised with the quality. And third one is the predictive intelligence. In that case, we would like to that mention over here. So whatever tools which we are adopting in the routine supply chain process, they should be robust one and under the harmonized SOP guidelines. So in that case, we can ensure that whatever quality goes to the end user like a patient. So whereby we ensure that care chain whole process that is again going to the right manner and the right condition. And fourth one is quality should not be that limited to the quality department only. It should be further extended to the across the other levels as well, like manufacturers and supply chain that partners and then logistic partners and the distributors and the again healthcare partners.
Correct. Very well said. So talking about the AI, we have a Mohit. So what I need to understand from you, you have a multiple experience working with the multiple industries in healthcare, especially the supply chain maturity evolves. And what I need to understand from you, that which AI enabled capabilities such as forecasting, demand forecasting, inventory optimization, predictive risk alerts will have the greatest impact on healthcare supply chain resilience over the next 5 years?
Okay. So when we say AI in demand forecasting, yes, it is required. Healthcare supply chains can't work on the purchasing history. It is driven by clinical events, any outbreak of pandemic, or there are many other reasons, be it seasonal demands, or the, you can say, lifestyle diseases that are happening in recent past. So AI in demand forecasting is required. Yes, we have to handle these complex forecasting mechanisms. Now AI in inventory optimization, yes, it is required. It is rightly said by my colleagues that SKUs in healthcare run in thousands. So today we are performing diagnostic tests. The material, the raw material ranging from chemicals, consumables, reagents, it runs in thousands. So yes, inventory optimization is also requiring some digitizations and intelligent tools. Now when I come to the third part, AI in sensing the risk, predictive risks. What I feel that is of paramount importance as compared to the other two. I'll give you an example. Let us say I am running a diagnostic lab. If I am able to predict that my machine which is performing tests on a sample is going to have a breakdown after 1 lakh cycles based on their history of preventive maintenance, based on the parameters of the machine, based on the environmental conditions in which the machine is operating. If I am able to predict it, that means I am able to give a better experience to my customer. If I am taking the blood sample from the patient, I know that this lab is going to be down for another 5 hours, so that I can deliver the sample to the nearest other lab and perform the diagnostic test, because that test will define the future course of action by the clinician. So in my view, AI in predicting the risk sense is of paramount importance as compared to the other two, because AI in demand forecasting will give you efficiency. AI in inventory optimization will improve your working capitals.
Correct.
And AI in predicting the risks will give you resilience. And resilience is something that will give you an edge over the next 5 years in healthcare, because a single disruption can threaten the patient care.
Correct. So absolutely correct. The agility, the resilience, and the patient-centric is very important. And with the AI, we can actually reform all these things. So coming to Vikas, we understand that while organizations continue to strengthen upstream supply chains, the last mile often remains the most challenging. From hospital network perspective, what practical strategies and partnership are needed to address last mile challenges and ensure reliable access to the healthcare products and services?
Yeah, so in a hospital, just I take an example, ki we all are using the Google map from reaching from destination A to B. And the Google map shows ki this route will take a 20 minutes, this will give the 15 minutes. So the same clarity if we have for the healthcare products from manufacturers to hospital, ki this product, particular brand or this time, it will take 10 days to reach to the hospitals, or the brand B will take 6 days to the hospital. So it will be a great help for the clinicians to decide the patient diagnosis, patient treatment, and prescribe for the patients for the availability of that product. So that clarity we required, and that which technology, if we are do for our transportation, so I am sure our technology guys can do for the healthcare as well.
Correct.
So if we see for the other aspects of the healthcare, if we see how we can managing the supply chain and what the support we required from the various industries, manufacturers, transporters to make the supply chain safer, quick, and affordable for the patients. The first is building regional distribution. So we can't depend upon the one distributor which is on the center of the city and supplying to all the areas of the hospitals. So we require the regional distributors, so that reduces the delivery time and make sure that less transportation time and less cost is occurred to transfer the material from distributor to the hospital. Second, real-time visibility, how much inventories the manufacturers are able to make, how much is available in their central warehouse, and how much is available in the hospitals. So that gives us a clarity and avoid the hospital for the overstocking or the understocking as well. Third is strengthening supplier collaboration. So we are like on the hospitals, we have a doctor, nurses, supply chain team, other paramedical staffs. We are considering as a family. So we have to consider the manufacturers and the supplier as a partner, as a partnership of the hospitals. Because if they are not able to supply to material, we are not able to treat the patients. So they have to have their core family members, and we have to build a good relationship with them and understand their priority as well as the understand of the healthcare priorities over there. Next is in a healthcare, we are using a temperature, cold chain sensitive products, starting from the minus 20 degrees Celsius, that is the refrigerated products, 2 to 8 degrees Celsius, that is the cold chain, 8 to 15, the cooler place, and the 15 to 25 degrees is the room temperature. So we have to adhere the transportation of these materials of the different temperature grade from manufacturer to the hospital and from the hospital to the IPD and OPD patients till they are administered to the patients over there. So that type of transportation, safety, measurement and real tracking is required for the cold chain products in the hospital. And that is very important, very costly. Slightly change in the temperature range will reduces the potency and efficacy of this product and may delayed or prolonged or make the costly for the treatment for the patient as well. If we see the hospital inventory, if we are building a more inventory for 3 months, 6 months, 9 months, they will use less. They will increase our burden of the hospital, maybe increase the dead stock. So we require the economic order quantity, where the AI will come. What is my seasonal variation? What is my last year practices over there? What are the new diseases trend coming in the market? What is the practices of my doctor prescriptions? If we are using the hospital information system for generating the prescription online, we can understand their prescription practices and accordingly we can stock. So we move from the holding the inventory to the smart procurement, smart stocking in the hospitals over there, where the AI is very much required and we have a tools available that we can implement in the hospital. Second, in a hospitals, we can't say no to the patient. Okay, this medicine is not available, this particular test is we are not able to do, so this treatment we can't do. So we have to have an emergency preparedness. We have a backup system, backup plan to arrange the stocks, or the alternative we can give it to our clinicians so that they can continue the treatment in the hospital. Next is, this is important, we have to measure what is important to us. Like my friend says, the KPI, which is very important for the supply chain. We have to know what are my important KPIs, like my local purchases, stock outs, inventory days, how much vendor suppliers we have, how much standardizations we have, how can I do the variety reduction in the hospital. So certain KPIs we have to measure in the hospital. So in a nutshell, the last mile is not a logistics challenge. It is where the healthcare promise is fulfilled. and we as the supply chain leaders, the smartest supply chain leaders with the tools available, definitely we can provide the best care to our patient, and we give the assurance and hope to the patients and their family members. Yes, they are in the safe end. Thank you.
Correct, Vikas. Thank you so much. So I can say this thing that today's discussion completely reinforced the healthcare supply chain. And it is not just about moving the product, it's about moving care, building the trust, and saving the lives. So thank you everyone, the eminent speakers, and thank you for sharing their perspective. Thank you.